Yeah, so I'm Anna, I'm the Director of Public Health. Really good to see so many people on the call, and welcome today, and thanks for coming. People keep asking me what my strategy is to get the vaccination messages out to local people, and I keep saying you. So our champions basically, and our other system leaders, so our imams, our church leaders are absolutely vital to getting that out there. So we're really, really lucky today because we've got Dr. Colin Speers, who has done a lot of good work in Wakefield around all sorts of things, diabetes being a specialist area of his, and he's also the clinical lead for the COVID vaccination programme. He's come to talk to us today, which is really kind, Colin, because I know how incredibly busy GPs are and primary care are, so we really, really appreciate it. And I'll just let you say hello.
Hi everybody. So I'm not in a prison cell, the bar's behind windows. I'm currently in Castleford at one of our vaccination sites.
Brilliant. So you're at a vaccination site. That makes it even more exciting. And then I just want to introduce Jo Fitzpatrick, who's our lead officer for the vaccination programme. So she's our senior responsible officer across the Wakefield patch. And that's a fairly sort of, as you can imagine, an incredibly busy role. And again, we're incredibly grateful that Jo's taken time out today to come and talk to all of us. So Jo, do you want to say hello?
Thanks, Anna. So yeah, hi, I'm Jo Fitzpatrick. Some of you might have met me. I am a pharmacist by background, and I've been working in Wakefield for 19 years, and I am I'm a Featherstone girl. I live in Wakefield as well, so hopefully know our population really well. And I'm responsible for ensuring that all of the eligible population in Wakefield can have access to the vaccine when it's their turn. And making sure that we've got all our sites operational and running well and safely.
Thanks, Jo. And then we've got Emma Smith, who works in my team, who's the Head of Health Protection. Emma, do you want to say hello?
Hi, everyone. I'm sure some people have heard from me previously. Thanks for joining us today.
And then we've got Kerry, who's already introduced herself and is also sort of a key member of the team. So I think that's all of us.
So I think we're moving over to Jo now. If you could just do a bit of an introduction to the vaccination programme, Jo, for us.
Thanks, Kerry. Yeah, so the vaccination programme started, as you will all be aware, because it is so much in the media. It's probably one of the #1 topics at the moment out there on social media and the general media as well. So the vaccine rollout is starting. It's actually started, we will say, and I'm going to give an update on where we are in Wakefield with it. But we have started with the vaccination programme in December. That's when the Pfizer vaccine that you will have all heard about got its marketing authorisation. And then on the 31st of December, that followed very quickly with the AstraZeneca Oxford vaccine gaining its authorisation as well. So we are fortunate in this country that we've got 2 vaccines to choose from to vaccinate our population. And if we just go to the next slide, please. So how the vaccination programme works, it's a national vaccination programme with a central control centre that decides, an expert panel of people that decides how the vaccine will be rolled out, and also on how much vaccine supply goes to each area of the country. So in terms of the priority cohort groups, the Joint Committee of Vaccination and Immunisation, the JCVI, that's what that stands for, they're an expert panel of people who look after vaccines and immunisations for a range of diseases, not just COVID. And so they're real experts on this, and what they've done, they've looked at evidence, they've looked at the vaccine, the properties of the vaccine, they've looked at the evidence of COVID and which parts of the population suffer worse from COVID when they get it, and they've used that to decide on how we roll out that vaccination programme, because we can't just make it available to everybody straight away. Through supply and also through capacity to be able to vaccinate everyone. So the order of priority is #1, residents in a care home for older adults and their carers. So if I just give a number there, so if you're a resident in a care home, you only need to vaccinate 20 residents in a care home to prevent 1 death from COVID. So that is the reason why care homes, and that's compared to 150 people over the age of 80 who live in their own homes. So that is the reason why, and we know that care homes have been particularly badly hit by the COVID virus in terms of worse outcomes and deaths. So very important that care homes for older adults and their carers were in that first vaccination cohort. Then it's all those over age of 80 and frontline health and social care workers, because they're the ones that are having contact with the public and also with vulnerable people. And also a workforce that needs to keep going really, and not having to self-isolate due to having COVID. And then it moves further down in terms of age range, which is all those over 75, and then to those over 70, and in with that is added clinically extremely vulnerable individuals. So that's the ones that have been asked to shield during the COVID pandemic. And then further after that, we move down to over 65s alongside those that are deemed high risk, and there's some categories that talk about that. And then we're going to over 60s, over 50s, and the eventual aim is to vaccinate everybody over the age of 18. But it is estimated that the groups above on this slide, over 50, are the ones that represent about 99% of the deaths from COVID, or preventable deaths if we vaccinated people. So if we can get everybody over the age of 50 done, we've really made a big inroad into fighting against this pandemic. So in terms of where we are at the moment, in a care home for older adults and carers in Wakefield, we anticipate, and the target that we've been set is to have everybody, every care home visited and the residents vaccinated by the end of Sunday, the 24th of January. So that's the date, and we anticipate that that will have happened in Wakefield, and it's the primary care networks, which I'll come on to in a moment, that are delivering that. In terms of all those aged over 80 and frontline health and social care workers, the target was the end of January, and we are on track for that, with a few caveats for exclusions such as the housebound, but we are catching up rapidly with that. And the reason why we're a little bit behind with the housebound is because of the vaccine. We were only given permission to move the AstraZeneca vaccine out to housebound patients last week, so that's why we're catching up with those people that can't, that aren't mobile and able to get to a vaccination centre. And then the next target is by mid-February that we'd have all our over 70s and clinically extremely vulnerable individuals vaccinated as well, and we are on track with that, and should receive the vaccine supply to do that. And then we're putting in plans after that for the other cohorts. So if we
It's me. So I think this slide is just about demonstrating that we have a long-standing history of vaccination campaigns within the UK, and vaccinations go through rigorous processes all the time in terms of safety checks, and that's both at the trial phase and sort of the manufacturing phase as well. And every vaccination batch that's produced, it always is tested before it goes into sort of the population domain and public. And I like my bake-off, so I liken it to sort of baking buns in terms of vaccine production. So we have our tried and tested recipes, we follow those recipes, we check our ingredients before we start making our vaccine, we check our oven temperature in terms of safety checks, and these checks happen for vaccination in the pathway. And then we get our buns, our 12 buns at the end of the day, and that's likening it to our batch of vaccine. And with buns, we can't resist that urge to just eat one. So we always will check that one bun batch before we share it with our friends and families. And a similar process happens with vaccine. We always check the batches that are produced before it is then delivered into the public domain. So vaccine is really got rigorous safety mechanisms around it. And this side just says as well that we've a long-standing history in the 1700s when we introduced the smallpox vaccination, and then prior to the COVID vaccine we had the HPV vaccination. So we do have a trusted history of delivering vaccination programs and the benefits that brings for us. Next slide, please. So I've briefly touched on this aspect already. So next slide, please. And I'll hand over to Colin, who's going to talk about how the vaccines themselves work.
Hi everyone. So I think it's important to think about with vaccines is that the stage we're at now is usually built upon decades of research before. And there have been questions as to how the vaccines have been able to be released so quickly. It's because of that previous work. So the Oxford AstraZeneca vaccine is actually based on work that was done on an Ebola vaccine. And all vaccines work in a similar way, which is to expose your body to a part of the infectious agent, so the virus in this case, but not the whole virus or a dead version of the virus that can't reproduce in your body and make you ill. So to expose your body to a bit of it so that when the body is exposed to the real virus out in the environment, it's experienced it before and it's already been triggered to build an immune response so it can fight that off. So you receive the vaccine, your body builds antibodies and also builds immune cells which can fight the virus or fight the cells that the virus infects when you encounter it in the future. And that you either catch COVID in this case, but you experience much milder symptoms or no symptoms, or you catch COVID. Thank you. Next slide.
So this is back to me. So we have a long history of effective programs in the UK, and this slide just looks at the different programs that we have had over the course of the years, but in particular I'd just like to highlight the measles. So we had measles in general population sort of in the 1900s, and then we saw the introduction of the vaccination program within 1968, and the benefit of that vaccination program was we've seen a reduction in measles over a period of time, and obviously presently we see less and less cases. And in terms of measles, you will be very familiar with people reporting measles outbreaks, and what happens in those situations is where certain pockets of the population or certain groups don't actually participate in the program or haven't been vaccinated for whatever reason, and then we see measles cases arise, and then any unprotected individuals are susceptible to measles, and then we have what is described as a measles outbreak. What the COVID vaccination is trying to do is to do this at speed as well. So this is why there is this national ambition to have as many people vaccinated as quickly as possible, and working through the JCVI groups as quickly as we possibly can, because what we want to do is shorten that sort of period of time from where we introduce the vaccination program and the number of COVID cases we subsequently have. So the quicker we can deliver the program, the quicker the individuals can be vaccinated, and the quicker we can protect those individuals. And so that time period of seeing a reduction in cases is shorter, and we see a reduction in cases a lot quicker. And I think this slide just illustrates the benefit of an immunization program quite well. Next slide, please. And this is sort of points of contact for trusted information, because we know that a lot of information is circulating in the public domain. We know a lot of people have questions, a lot of people are anxious about the vaccine, and sort of the real important factor is where can you get trusted sources of information, and all of these websites will provide you with that information in great detail about what are the plans for the vaccine, the benefits of the vaccine, if you're pregnant, if you're breastfeeding, we get the fertility questions, if you've got any other clinical conditions, how does that affect the vaccination program. People are anxious about having allergic reactions sometimes to vaccines, and then we have information about there, and we'd always encourage people to have that clinical discussion with their health professional before they actually have the vaccination if they've got any concerns about their individual health or their individual needs as well. Next slide, please. I'll pass over to Joanne now.
Thanks, Emma. So in terms of how we are delivering vaccines across Wakefield, in the beginning of the programme, the GP practices were the first people to be offered the vaccine through a service that they could provide, and they were asked to collaborate as the primary care networks that they are already part of to be able to designate sites that they could deliver the vaccine from. Now, these sites, there was a lot of, there was a time pressure on being able to stand these sites up, and it had to be sites that were not going to affect the running of the GP practice business, and they had to be sites that were able to be registered with the CQC as being clinically appropriate and safe, and also available for the vaccination programme. So they were the criteria the sites had to be selected. So in terms of the primary care network sites, the sites that were designated and approved are Castleford Civic Centre at Castleford, King's Medical Centre at Normanton, St Swithin's Community Centre at Eastmoor in Wakefield, Sandal Rugby Union Club, and the Churchview Health Centre at South Kirkby. In terms of the hospital, so they're delivering the vaccination to our over 80s population, and they've just opened up the vaccination to the over 70s and clinically extremely vulnerable as well. And they are also doing what we call the roving vaccinator model, whereby they are mobile, taking the vaccination out to the care home staff and residents in the care homes of our district, and also to the care home staff, and also for the housebound as well, sorry. In terms of other sites that are available in Wakefield, we have 3 hospital vaccination sites. They are purely for the vaccination of health and care workers, because as you saw from that priority group, they were part of those priorities as well. And they are easily accessible for the bulk of our health and care workers, frontline. And then the other places that we've got coming on board as well is the Community Vaccination Centre, which is due to open on Monday. And that is through the National Booking Service, and that I can announce is at Navigation Walk in Wakefield, which is on the waterfront up near the Hepworth. People can book onto that if they have received the letter through the post, as so the priority cohorts, I think over 75s are currently being sent letters through the post if they've not already received the vaccination at a GP practice site, at a PCN site. And they follow the instructions on there and can choose to go to a community vaccination centre to have it booked. Don't have to go to the one. You can go to one that's, I think you've got the opportunity to go to one which is in a 40-minute drive of your home address. So the slots are open for Navigation Walk, as I understand currently, or will be going live very soon. In addition to that, tomorrow, we've got the Community Pharmacy Vaccination Centre run by a company called Pharmacy to You, you might be familiar with. They're opening tomorrow at the Morrison's car park at Dewsbury Road at Lupsit. And they also are part of the National Booking Service. So again, it's you're offered a slot for your appointment from booking in through the letter that will be received through the post when it's your turn to be invited for a vaccination. And there is the potential to open more sites if required. We are looking at another Pharmacy to Use site elsewhere in Wakefield, but that is all subject to site readiness and value for money checks at the moment, to make sure that it is appropriate and right for the population to go there for their vaccination. And that's it in terms of the delivery model. In terms of how we're doing as a district, we are doing very well. The North East Yorkshire region's vaccinating quite a good proportion, and Wakefield as a place amongst the North Eastern Yorkshire region, we have got a good uptake of the vaccine in our over 80s population. And like I said, by Sunday, we expect all the care home staff and residents to have been offered a vaccination. And we are on track to meet that mid-February deadline for clinically extremely vulnerable and the over 70s too. So it's we are all in a good place in terms of the ability to vaccinate. Just a note about patient experience as well. A lot of the feedback that we've had from people that have gone to have their vaccinations at the vaccination sites to press have all given really positive feedback. We've received quite a number of compliments around the patient experience. So to date, it's been very good. But obviously we are continually obtaining feedback from the sites and looking for improvement and sharing good practice amongst the sites, whether that's a hospital site or the places where the primary care networks are delivering the vaccination, in order for us to learn. It is a learning process. We've set these sites up in response to the demand for the vaccine and the vaccination programme, and people have worked incredibly hard and in order to set these up and to vaccinate good numbers of our population so far. So if we just go to the next slide, please. So in terms of when you get the vaccine, so as I've just talked about, the JCVI priority cohorts is the factor which defines when people will be invited to come and have their vaccine. It's important that you don't contact the NHS for a vaccination before you get your invitation, because GP practices, for example, they are using their phone lines for a lot of consultations at the moment, so it's important to keep those as free as possible. And also they're very busy doing their normal business in addition to running a very complex vaccination programme and delivering those vaccines. So it is important that we keep the GP practice lines free as much as possible. And people will get their letter if they are registered with a general practice. For people that aren't registered with a general practice, we have got a separate work stream that are looking at that to ensure that nobody is disadvantaged just because they don't happen to be registered with a general practice. And we will we'll have plans in place. We have got plans in place in order to be able to vaccinate those people as well that aren't registered. So as I've said, either a GP practice will contact the people in those priority cohorts to have an appointment, has been happening since the middle of December when we started on this programme. And also letters are being sent out to people on that list every week from the national programme, from the national booking service as well. But it might be that people don't get that letter straight away because we have to manage this in tranches. There's only so much vaccine supply coming out every week. But all I can assure you is that we are on track to vaccinate everybody with the supply that we've got. If we go to the next slide, please. So I'll hand over to Colin just to give that frontline general practitioner perspective of your experience over the last few weeks of the primary care network sites being operational. Colin, please.
Again, everyone, you'll notice I've moved areas because this site was being used, space being used for lunch, but they've all left it now. So this is the stage at Casford Civic Centre for those of you that know it. So the programme's been going very well, very fast. General practices have been initially inviting in their registered patients via phoning them up as the quickest way of getting in touch with people to book them into the site, because initially getting quite short notice of when vaccines have been available, and it's been very hard to forward plan weeks and weeks in advance to know what the appointments will be. We're probably getting to the stage where some practices will also be starting to send you out some letters inviting you to phone them alongside the letters that you'll be receiving from your from the National Booking Service. And also some practices are at the stage of starting to use a booking system that uses text messaging, so that you receive a text message which comes from your practice, but those that don't have mobile phones smartphones to be able to use that, they'll also be you'll also be approached by your practice through another mechanism. The vaccine that we're using is, as we've said before, has been through lots of checks. As a frontline worker, I've had my vaccine about 3 or 4 weeks ago. It's very common for people to get a slightly achy arm when they've had it the next day, and some people can experience a couple of other mild side effects which disappear after a day or two, but can include things like feeling tired, having headaches, or feeling a bit warm or a bit cold. You'll notice here that it talks about there's been a change in how the vaccine's been delivered compared to how initially planned. So initially we planned to give a vaccine and then the first dose, and then book in for 3 to 4 weeks later, second dose. The Chief Medical Officer, officers of Great Britain and Northern Ireland, as well as the JVCI, Royal College of General Practitioners, Public Health England, and very many august bodies, all put forward a recommendation that was important to get as much coverage to the population as quickly as possible. And that's based on them relooking at the evidence, which shows that, say for the Pfizer vaccine, about 2 weeks after you've had your first dose, you're probably that coverage will probably be about 90% effective. You see various numbers, and it's really tricky. So you'll see numbers that go from somewhere between 74% after 7 days to up to 90% after 2 weeks. And for AstraZeneca, that's about 73% after 22 days. So that means that, 100 people that were given the vaccine, 73% of the 73 of them would have a good level of protection and wouldn't experience, most importantly, severe COVID symptoms that would result in them requiring hospitalisation, but also increases the rate of them not having COVID symptoms at all. And that's why we've seen a delay in this second dose, which will take place 12 weeks after your first dose. So further invitations will come out from both the national booking system as well as from your local GP practices to invite you in for your second dose, because we've got records of when everybody has had their first dose as well. Okay. When you come in, there'll be the opportunity to ask questions, but we also take each individual through some counselling to tell them about the vaccine, ask them some questions about their general health that could be a factor in having the vaccine. But it's important to note that there's very few reasons why anybody can't have this vaccine. In fact, it's basically if you're under 16 or if you're currently pregnant. There have been some concerns about severe anaphylactic reactions in relation to the Pfizer vaccine, but as we've gone further forward and seen more use, we're seeing not very many episodes of anaphylaxis, and it's actually very particular bits, the stuff that's inside the vaccine itself, which is something that you would expect anyway. So we've reduced some of the warnings around the reasons why you can't have the Pfizer vaccine. But those that approached were invited in very early on that had a history of having had a severe allergic reaction, so an anaphylactic reaction, may have been been advised that we should delay it until later on and be offered the Oxford AstraZeneca vaccine. And all sites are kind of currently working on a plan to invite those that were excluded as a consequence of the anaphylaxis history in for an AstraZeneca vaccine. And that's something that's going to be happening over future weeks. So we're constantly tracking who's had the vaccine. We're constantly figuring out who we've got to invite in. We're all aware that there are people that are in care homes that we think we've done the care homes, but there may be new people going to live in care homes. And so we're tracking those people that are still outstanding for their first dose and coming up with plans to make sure that we get everybody the opportunity to be invited in. Of course, people may choose to decline to have it. There are mainly two other reasons why we wouldn't want you to come for your COVID vaccine, and that's if you're currently unwell. So particularly if you're experiencing a fever or COVID symptoms, we wouldn't want you to come in. We generally have advice that if you've had COVID within the last 4 weeks, initially we said you shouldn't have it. Now we would say that if you're still experiencing COVID symptoms, that you shouldn't have it. And that's mainly in case you get more unwell with your COVID. We wouldn't, after you've had your vaccine, we'd like to know that it's because of the COVID and not because of the COVID vaccine, which we would expect you to get some side effects from. But as I said before, your GP practice will invite you in, so please don't contact them, because they're currently phoning hundreds of people a week per practice to invite them in for a COVID vaccine, alongside all the other work that they're currently doing. And there's also going to be those national letters coming to you. And when at the end of your vaccine, you'll be offered information to take home in the form of leaflets. And there's also really good quality information out there, particularly on the NHS website. Now, can I have the next slide, please? So I think this is really talking about, the scale of this. So we have never ever vaccinated an entire population in these timeframes before. It's a monumental effort, which is incredibly important to free us all up from the threat of COVID, and also to allow us to return to more normal lives. It's really important to think about, though, that after people have had their COVID vaccine, they're not instantly immune. And so really important that everybody does continue to follow the national guidance about hands, face and space, because it takes a while for that individual to build up immunity. But also at the moment, we don't know whether somebody who's had a vaccine can still shed virus if they become infected. So there's a missing element of data and evidence that we're trying to get, which is, does vaccination mean, as well as protecting you from getting severe COVID symptoms, does it protect the population from you infecting them? So until we know that, it is important to continue with the national guidance. Can we continue? Go to the next slide, please. And this is about scams. I was really saddened by this, and I've had examples of them sent through to me. So it's really important to know that the NHS will never ask you to pay for a COVID vaccine. This is entirely free, and nobody should be asking for any details from you as a method of proving who you are. So you'd never be asked for your credit card or debit card number. At a push, you might be asked for your date of birth to prove who you are, and that's just to check that they're speaking to the right person. If anybody phones you, it should be from a practice that you know. And if you're uncertain, if you think you've got somebody that's phishing for it as a method of fraud, please, feel free to hang up and phone them back if it doesn't seem entirely appropriate. The letters that we send out will all be appropriately branded, so they'll have the NHS branding, it'll have details about who sent it through. And if you get a text message, it would most likely come from your own practice, or it